And welcome back to the Factor Uncensored. Here's a weird one. If you need a laxative, you're going to have to get creative. There's been a huge demand for the product recently, but all hope isn't lost despite the shortage of laxatives in the United States. We talked to Dr. Ali on why people are constipated. Take a look.
We got some people constipated in America who's not regular, who's not keeping up with their fiber. And so we have a shortage of laxatives in this country, which is the first I've ever heard of. But first of all, why can't people, go to the restroom and be regular like they should in this country right now?
Yeah, Isaiah, there's a lot of factors behind why this is happening, Isaiah. But yeah, right. Yeah, I mean, we are seeing folks that are coming into the hospital with constipation, that they haven't had bowel movements for many days. They get what we call an ileus, and that's a blockage and a stoppage of the stool because it's so tight and closed off and can't pass through the passage like it needs to. And so there's a lot of factors for this, but mainly, as you alluded to, Isaiah, it is fiber and the lack of, right? So fiber helps consume that water into our bowels and helps that to lubricate it. And so we can propel and expel that stuff out. However, because we're not consuming enough fiber, enough greens, things of that nature, that's why we're seeing this high amount of constipation and now leading to a shortage of some of these medications that would help with that.
I remember long ago, Dr. Ali, I had a family member who could not go to the restroom, and I ended up in the emergency room with them. And the doctors had to physically go in and pull it out. I didn't see all the details, but I was there and you smelled all the details. But when does it become dangerous for a person?
Right. So, Isaiah, everybody some people go multiple times a day. Some people go, every 3 days. So whatever that norm is for that person, and if that exceeds that, then that's when it's considered, and usually it's like double the amount. So if you go every 3 days and now it's been a whole week and you haven't gone,
Wait, stop for a minute. There are people who go every 3 days? That seems like a long period of time.
A lot of women, actually, surprisingly, a lot of women go multiple days without having bowel movements. And so that is common. And that's something we see depending on how, folks their normal structure is and how they're made up and how they normally have been going for years.
So long as they're regular within a certain period of time. I would have to think like going a week, though. That would be borderline dangerous, right?
That's correct, Isaiah. Problem is everybody, a lot of these folks are either taking medications that can cause constipation. We know that coffee also does it. It also excretes out the water. And so those are all—
What about cheese?
Teas are a little bit okay. Coffee, especially the caffeinated coffees, are the ones that, you have to be careful of. And especially folks who drink every day, it can also affect them as well. So again, there's multiple factors behind it, but the point is eat a healthy diet that consists of greenery and lots of fiber, and that will help. And then also be aware of some of the medications, specifically like opioids. These sorts of pain medications can also cause constipation. And so just to be on a regular program, if you are on some meds like that, you may want to consider being on a stool softener along with those pain medications. And then again, as I said, dietary consumption is very important.
And now we are seeing, as a result of so many people here in this country being constipated or not using the restroom regularly, a shortage of laxatives. That's a first, too.
That's correct, Isaiah. Yeah, and we've seen that with different manufacturers, different brands. There's so many different ones out there. However, there are some that are in shortage because people are relying more on those. And now, these were medications that were initially meant to be taken, not regularly. They were supposed to be taken if you have those times where you're constipated. People have gone to this regimen where they now are taking it every day, even though they may not be on any medications or anything that may cause that. And now your body gets used to that medication. And now you're either, taking it regularly or you're taking more of it.
Clear yourself up. Clear yourself up. That'll do it for us tonight. We'll see you back here next week.